Which healthcare profession is right for you? Should you go and become a PA, or should you go the MD or DO route instead? I want the future doctors of America to go to medical school, and I want the future PAs of America to hit that subscribe button down below. Hey, what's up guys? My name is John and I'm an emergency medicine PA. And this video has been done countless numbers of times, so here's my take. In this video, I will be comparing these two professions on a number of categories, from job stability to compensation to lifestyle and work-life balance, overall length and difficulty of schooling, and lastly, prestige. I want to get down into the nitty-gritty and all of the nuances. I also just want to mention that whatever specialty you want to get into will be a big factor in which career path you decide to choose. And listen, I understand the stakes. This is your career. This is your future profession. It is a big deal. This is a really big decision. Before we get started, quick shout out to my VIP patrons on Patreon for helping support the channel. Common thoughts and misconceptions between the PA, MD, DO debate, first and foremost, is age. There are people in their 30s, 40s, and 50s matriculating into both PA school and medical school. I understand that PA school is more enticing because of the shorter amount of schooling. However, if you truly want to go to medical school and become a physician, do not hold yourself back. You should be applying to medical school. Money. If money is your primary motivator, this may be controversial. You should consider going to medical school because on average, physicians will be earning 2, 3, or 4 times the amount of money that their PA counterpart would be earning. And there are some physicians earning an insane, unimaginable amount of money. Being a doctor is consistently one of the highest paying professions in the United States. Family pressure. If your family is saying that you need to be a doctor, a lawyer, an engineer, or else they will disown you, do not succumb to family pressure. This is your life. This is your choice. And you should not commit to 6, 7 years of PA school or the 10 plus years required becoming a doctor just based on what your parents want you to do or what your family want you to do. You know, you should do what is right for you. You should do what is in your heart. And lastly, the misconception that PA school is your backup plan or the path of least resistance. If you are doing everything required of you as a pre-med student to get into medical school and you don't make it for medical school, PA school should not be your backup. That is a horrible idea. It is a horrible plan, and I'm going to tell you why. PA schools are very good at sniffing out disingenuous candidates, people who were trying to get into medical school and now are falling back on PA school. But secondly, even if you were to get into PA school and pass, who is to say that a couple years down the line you will not severely regret your decision of not just reapplying to medical school or doing more to get into medical school? If you're using PA school as your backup, it's no cakewalk. The Association of Medical Colleges released a report saying that the average matriculation for just over 53,000 medical school candidates was just under 42%. Meanwhile, PA school acceptance rate is about 32% right now. And both paths require you to have an above average GPA, while medical school requires you to take the MCAT, and PA schools want you to have hundreds, if not thousands of hours of patient care experience before you matriculate into their program. If both options are pretty difficult to get into and you really want to go to medical school, you should go to medical school. I know of an individual who failed getting into medical school 3 times, but now he is a practicing physician and he is happy with his decision. So imagine what would happen if he didn't have the perseverance to continue to keep going on with his dream. First, talking about medical education, the difficulty and length of study. For those of you who want to go to medical school, who want to become physicians, you already know the MCAT, medical school itself, and all of the step exams, residency. You will have thousands of hours under your belt. You are at the pinnacle of medical expertise. If you go into a room, you are the supposed expert in your field. Both the PA and MD-DO route require you to have an undergraduate degree. However, medical school is 4 years in length, while PA programs are usually just over 2 years in length. Medical school usually involves 2 years of didactic or in-class learning, while PA school only requires 1. Medical school will then have you go on 2 years of rotations as a medical student, while PA school will have you go on 1 year of rotations. And believe it or not, the rotations are usually the same. As a PA student, you are in the same rotations as the medical students, the difference being the amount of time and exposure that you're there for. As a PA student, you do have, family medicine, internal medicine rotations, pediatrics, emergency medicine, general surgery, women's health, psychiatry, and then a few others of your choice. Another huge difference is everything that happens after you graduate. So when you graduate from medical school, you now have a residency which could span anywhere from 3 to 5 years or more. And then sometimes after you complete residency, you could choose to spend a few years doing what's called a fellowship, which is additional training. As a PA, when you're finished, they do have residencies which aren't actually residencies where you can do additional post-grad training and education. But for the most part, that's it. In terms of medical knowledge and applying that medical knowledge, I would give team physician a 10 out of 10 and team PA 6 out of 10, maybe a 7 out of 10. In terms of length of study, if you want to give it a metric, obviously team PA would take it because it's a shorter program to get to practicing and less time required to start working. So now talking about job stability, the future of each profession, being a physician has stood the test of time. Meanwhile, PAs are more of a specialized profession recognized only in a few countries. Doctors can't be replaced. We will have a constant need for physicians. Now, with that being said, being a physician assistant was rated the best job in America for 2021. Personally, I do not see the PA role vanishing in the United States at this point. However, there are some bumps in the road. What should a PA's scope be? In addition to, we just recently changed the title of our profession. For job stability in my useless point system, team physician would get a 9 out of 10 and team PA would receive an 8 out of 10. Compensation and ROI. Physician assistants earn very good money. The average PA is earning $115,000 a year, and the top 10% of PAs are earning more than $170,000 a year, earning more than $220,000 a year. The average doctor, very dependent on specialty, they're earning anywhere from $250,000, $300,000, $400,000 a year. Some physicians earning $800,000 a year. It's surgical subspecialties or physicians who own practices earning more money than their counterparts who are just taking a salary. Something to consider is that as a resident physician, nowadays the salary is somewhere between $50,000 and $80,000 a year. Also, you have to consider the return on your investment. If a young PA finishes PA school and starts their job at age 24 or age 25 and they're earning 6 figures and they are investing that money, and the cost of PA school nowadays is about $90,000. They can pay off their PA school relatively quickly, start investing, and you know that time is a great asset to have in terms of compound interest and getting a good return on your investment. A PA can do really well retirement savings and generating wealth just by having a head start compared to their MD or DO colleagues that might be entering the workforce and earning their full-on attending salary much later in life. As a physician, if you have $200,000 to $400,000 of student loan debt, if you are diligent, if you follow something like the white coat investor, if you are paying down those student loans as quickly as possible and investing and doing good things with your money, you will have a crazy amount of wealth by the time you hit retirement age. As a PA, you will have a lifestyle in the top 5 or 10% of US households, while as a physician, you can have that lifestyle that is the top 1, the top 2, the top 3% of US households. Whichever path you choose, you will be earning millions of dollars during the length of your career. So this is something to consider. For compensation, team physician would earn a 10 out of 10, and team PA, I would probably give them a 7 or an 8 out of 10. Work-life balance and lifestyle. Objectively, you could say that PAs already have a better work-life balance because the amount of schooling is less. I would say that in most workplaces, while the PAs are held to a high standard, the physicians have, the utmost responsibility and expectations held upon them. It is a lot harder to separate yourself from your work as a doctor than as a PA. However, this is also very much specialty dependent. If you get into something like a surgical subspecialty, as a doctor, it is very hard to get away from your work. Something that people don't really consider is, say that you are a physician and you want to work part-time. You could earn $180,000 a year. That would be a crazy amount of money still. Yet it would still give you a ton of time to work on your passions, your goals. You're only working half the amount of hours. So that's something to consider. Or you could do a contract as a physician, work in a burst of maybe like 3 months, and then you have 3 months off. In terms of my pointless points scale, I would give Team PA an 8 out of 10 in terms of work-life balance. I think that PAs definitely have a higher work-life balance. I would probably give team physician somewhere between a 3 out of 10 if you are a surgeon and heavily invested versus a 5 out of 10 if you are just kind of the run-of-the-mill doctor, but then you have all the extra schooling and time requirement needed to become a physician. Versatility, I'm going to touch upon this super quickly. It is a known fact that for the time being, as a PA, you can go work in the emergency department for 2 or 3 years and then go transition into dermatology if you want, or into general surgery if someone's going to hire you and train you. By going the physician route, you are kind of locking yourself into a certain area. So I would assign points in such a manner. And lastly, guys, I want to talk to you about a category I made called prestige, and it shouldn't be a huge factor in your decision. The PA profession is not well known in the world. It is not well known even in the United States. Patients still don't know what it is that a PA exactly does. From my experience, the healthcare system and other medical providers do respect PAs. PAs do get a lot of the same perks that the doctors get. You do get included in, the provider meetings, or you do get included on rounding or the daily briefings and all of that sort of stuff. You are a respected member of the healthcare team. However, you are not a physician. You do a lot of work, but sometimes you don't get all of that recognition and praise. Doctors nowadays do get a lot of praise. Nurses get a ton of praise. The PAs, not all the time. You have to be okay with that. It sounds silly, but recognition of good work and feeling appreciated do go a long way in positivity and loving what you do. For this metric, team physician would get a solid 10 out of 10 well-respected members of society. I think team PA needs a little work on this. I think we need to do a better job on educating people on what we do, and a better way to, proudly say, I am a PA and this is what I do and this is the care that I deliver. Don't just take my word for it. I know you guys are the type of people who will do a ton of research in this. Let my voice be one of the voices. Take some time, think about it. You have a lot of time to think about it. We are talking in terms of years, and do whatever it takes to become successful. Guys, I hope this video helped you out. Stay safe out there. Have a great rest of your day. Bye-bye.